Hello, everybody. Happy Veterans Day. Happy Veterans Day. I know this is the day when we really appreciate everything our veterans have been doing to protect our country, United States of America. So, thank you very much for joining me live here. Today, I'm going to talk about um, very important matter which we all know about, and we are actually worried about Medicare cuts in year 2023. Medicare cuts means Medicare every year in the month of December and October, November, December, Medicare comes up with the proposed new fee schedule for our medical practices. Medicare talks about, Medicare reviews the codes, Medicare reviews the fundamental principle, rules of running your medical practice, and the reimbursements. Most important part is the reimbursement. And they decide what kind of a specialty, where are the opportunities to improve. And if you remember one of my previous sessions, I talked about quality versus quantity. I talked about quality versus quantity. So Medicare right now is focusing on quality of care, and that's exactly the long-term goal for Medicare is, or CMS is, to come up with the changes or Medicare rules which will ensure more qualitative care and a reduced cost of care. So, on the ongoing basis, this will always be the way US healthcare is going, is towards more um, reduced cost of care for members or for patients and increase the quality of care by putting some policies at place, introducing new protocols, changing existing Medicare reimbursement rates, and make sure physicians are incentivized based on their effort, the new effort they put towards the patient care. So in last 2 years after COVID, we have been seeing a significant uncertainty which was happening. So because of that practices, Medicare announced, if you remember, in year 2021, they have issued incentives to physicians about telemedicine. They have introduced new codes for physicians to bill using telemedicine, which was a big deal because then patients were able to render patient care just by sitting at their homes, or patients can get the medical care using their phones and mobile and other technology. Now, this is what going to happen. Well, I will talk about the good thing, and I'll also talk about the things which worries us, mostly the physicians. And as far as the new ruling is concerned, what we see, there are projected payment cuts to Medicare in year 2023 is at a large picture is about 8.5%. Yes, you heard it right, 8.5%. So in year 2022, practices absorbed a 2% reduction to Medicare payments, if you see, with the reintroduction of Medicare sequestration. So this is compounded by record-breaking inflation, reaching 9.1% is the inflation right now. So with that, Medicare has already been considering cutting the reimbursements by 4.5% as a reduction to the Medicare conversion factor, 4.5% to the existing Medicare conversion factor, the reduction would be, and 4% as pay to go sequestration, which was 2% last year, but this time they doubled it. There's a reason for that. And the reason is, so total, it's going to be 4.5% and 4%. Total is going to be 8.5% across the board. I'm not scaring you, but what can you do? Where are the opportunities to learn and to do more or help your medical practice? What can you do? What are the options you have as a medical practice? So, there is a medical group, not for profit organization called MGMA. I always quote them because they come up with fantastic studies. So they have come up with a study what medical practices are thinking about, what medical administrators are talking about, and and there are about top 5 6 things which most of the medical practices are worried about, and they are kind of thinking of um, doing it. So, to offset the reductions in payment, groups of all sizes are considering what business decisions must be made to ensure the financial solvency of their practices. So, I'll give you some of the numbers. So, 58% they are considering limiting the number of new Medicare patients, which means 58% administrators, they said they are going to limit seeing the patients, Medicare patients. So right now, if an average medical practice see 50% of their patients are Medicare patients, I don't know how they can do it. They can say no to Medicare patients, but that's what their goal is, to limit seeing Medicare patients and see more and more commercial insurances. Because my thought process is, if the Medicare is cutting 8.5% Medicare cuts, I don't think so any commercial insurances, why would they pay more, unless the physician practices, medical practices, doctors, they show a significant amount of quality of care, or increase in quality of care at their site. So quality of care and how to prove that quality of care to either Medicare or commercial insurances. So that is the opportunity for medical practices, that Medicare is saying, physicians, change your way how you practice medicine. Use more and more automation. Uh, Train your staff. Patient quality of care for patient, customer service to the patients. Those are the things. Those are the opportunities somebody needs to introduce in their medical practice. But 58% says that they are already considering limiting the number of new Medicare patients. 66% says they are considering reducing charity care. So if the patients are seen in the hospital, even by the non-par physicians sometimes, and then they just don't bill it to the patient, or just they cannot bill it as non-par. They offshoot, or they don't, basically. So they are saying, we are going to reduce those kind of patients. We may not be able to see patients if they are not in our network, in the hospital or senior care or assisted living facility. So 66% of them, they are considering reducing charity care. 58% are considering reducing the number of clinical staff. So if a doctor's office has 5 physicians, 15 nurses in a medical group or a medical practice, um, they may not have 15 nurses. Each doctor may have only 2 nurses, and doctor would see more patients, or these nurses would see more and more patients in order to cut the cost. Because with proposed 8.5% reduction in their revenue, they may not be able to handle, or they may not be able to have enough people to see the patient. So 58% of them says that they are considering reducing the number of clinical staff. 29% people, they responded and they said they would probably go and close their satellite locations which are not generating enough revenues. So some medical practices do keep these satellite locations where they see patients, even if those satellite locations don't make enough revenues. And if they make enough revenue just to cover the expenses they use to run those. But with proposed 8.5% reduction, they said, hey, this is not a profit center for us. We are not going to keep it. So probably those patients, they are going to lose, who was getting the quality of care or patient care in those locations. So these are like four important survey questions, where the survey has come from, and MGMA members, they responded to that survey and they talk about it. What are these medical practices going to do, right? What would be the impact of these payment reduction? So that questionnaire also asks, what are going to be your critical themes across states and geographic regions that will significantly disrupt patient access to care, practice operations, overall investment throughout the healthcare industry? So the top 5 practice themes that will result And I'm going to talk about those top five um, themes, what medical practices are going to do and how it is going to impact the payment reductions. So reducing, number one, reducing or eliminating the number of Medicare beneficiaries served. That is going to happen if what these people say, 58% people say that they are going to reduce Medicare patients. Who's going to see those Medicare patients? You remember the same thing happened when Medicaid cut their reimbursements. The reimbursement from Medicaid was very less at some point at like 4 or 5 years ago, and a lot of these physicians, they don't even see Medicaid patients. Same thing is going to happen with Medicare if this will continue. A lot of these Medicare patients would be dropped out of the plan, and the physicians may not even see them. There would be projected delays in scheduling care, resulting in up to 6 months wait of visit. So, and that has to do with a lot of these paperwork and a lot of the clerical job, which has been increased due to the quality of care Medicare has been asking, like prior authorization for almost all the codes, all the procedures. So if you have to go out and see a doctor, it's going to take, you're going to, I mean, it's going to delay your first, at least the first time you're going to see the doctor, even you're going to take, up your non-urgent appointment, or non-urgent appointment consults are going to take more time before you see the doctor, maybe 3 months or 6 months. Then decreased ability, that's number three, decreased ability to recruit staff at all levels, including physicians, clinical support staff, and administrative staff, especially in rural areas. See, right now in rural areas, if you have enough patients, um, even if you don't have enough patients, medical practices do hire some extra staff to see and render patient care. But if this 8.5% kick off, it would be limited for these people to hire additional help, which was available at that point of time because the revenues were higher. So this will drastically impact the patient care, especially in rural areas where nobody wants to go, and especially with the nurses and clinical support staff. If they don't want to, if they don't get paid well, they're not going to go there. There are other programs in rural areas which these physicians do qualify, and they do incentivize their practices in other areas. So that might be one of the opportunities these physician practices should apply for. I know there are programs where if your medical practice is in rural area, state incentivize or state pays you the difference between the patient care and your fee for that patient care. Four, at reduced participation in value-based payment contracts as limited resources and revenues are diverted away from non-essential practice activities. So so here you have to see, remember I was talking about quality versus quantity. So the more patients you see, is that the goal of your medical practice, or you see less number of patients, but at the same time you provide value, and you have you provide quality of care, and then you report that quality of care through Medicare tools like MIPS or some other programs, and find the incentives from the Medicare program. So physicians may not participate in those value-based payment contracts because they would have limited resources. And if they have a limited resources, they are not going to prove, like they're not going to participate in MIPS or other quality programs because they don't have enough nurses or a staff to handle all of that thing. So this is going to be a little critical how non-essential practice activities would be limited, and that will limit the physician to prove the quality of care to Medicare in those senses. Number five, as we said, if they close satellite offices or selling the practice due to insufficient revenue streams, which is likely to happen. My question is, even if a single doctor physician, two doctor physician, three doctor physician, small practices, even if they decide to close their medical practices or close their satellite office, how would it generate more revenue for a bigger group, or for for a group which is like venture capital based group or insurance companies. I don't see anymore. I mean, I don't see a way out how they're going to, if you as a small physician practice not making money, how would a bigger group who has more overheads are going to make money? So what's the option? The option is, why don't we small physician offices or small groups incentivize or work for the incentives by Medicare and try to claim those incentives by making the changes in your medical practice, what Medicare proposes. So Medicare is not only proposing the cuts, but they are also proposing the incentives if you are going to implement those changes in your medical practice, especially work with your EMR company, work with your billing company, outsource the activities which you are doing in-house, like prior authorization, referrals, coding. Have your billing company or coding company hire someone if you don't have, and look into your codes. There may be an opportunity for you to generate incentives based on what you're doing or the way you are practicing in your medical practice. Find an opportunity where you can have um, doing the things which are more in automation in nature, so like patient calling. You don't need to hire people for patient calling these days. Most EMR has a robotic function built into it. So it can send the text to your patients, it can send emails to your patient, it can call patients for reminders, it can also call patients for collecting their credit cards. So all of those functions you can automate, even for the smaller practice, one doctor practice, two doctor practice, you can automate all of those functions. So those are the things basically you have to think as a medical practice owner or as a physician to implement in your medical practice. There is one, it is so one of the I'm going to read some of the physicians. So there is a somebody says in Alaska that between the Medicare cuts, state Medicaid cuts, and commercial insurance is pushing to renegotiate lower contracted rates, they would need to take tough decisions as a practice to succeed and continue to provide exceptional patient care while maintaining provider and staff to patient ratios that support this level of care. This is a 60 physician internal medicine practice in Alaska. I'm going to read some of the Florida based practices, what they are thinking about this, because that will give you some of the ideas. So, one of the medical practices who has 110 physicians. It's a multi-specialty with primary and specialty care practice in suburban Florida. They says the projected reduction in payment will probably cause our practice to consider selling to an insurance company or private equity if we continue to not cover expenses. Now think about it, insurance companies or private equity, how are they going to make money for one reason? Think about it. If the medical practice owned by the physicians, run by medical administrators, if they are not able to run it as a profitable medical practice, how would somebody else will run it? And that's where your entrepreneurial and startup entrepreneurial mind comes in. And I'm going to talk about those opportunities. Where are the opportunities for startup entrepreneurs helping medical practices? Because if you remember, I have been talking about quality versus quantity. And if startup entrepreneurs can help these medical practices run more efficiently, run better, introduce automation, introduce IT stuff, tools, technology to make their medical practice more uh, have the medical practice run better with more efficiencies. That is what needed, and that is where, as an entrepreneur, as a startup entrepreneur, you can help these medical practices. Very simple things. Medicare has come up with a 3,000 page document. Think about it. It's a 3,000 page document which is talking about the changes or proposed reductions for different practices, different physician, different type of facilities. Who's going to read 3,000 pages? Just think about it for a reason. If you have a solution where it can pinpoint, it can exactly tell. So if I'm a cardiologist or if I'm an internal medicine doctor, I want to know what is there for me. what kind of changes are impacting my practice? How would I know? There should be some kind of way, and that's where you can innovate. That's where you can talk about innovation. It can be in communication, it can be as a portal, it can give some kind of some kind of information where it is impacting most. And that's where there is an innovation opportunity to innovate for medical startup entrepreneurs. Every year this happens. Every year Medicare comes up with their new rules. They come up with these things, and it is very difficult to decipher for somebody manually and then come up with a solution for a specific medical practice and a specialty. So it's almost 20 minutes now, but I wanted to talk about these things because it is very important as a physician and a medical practice owner to stay on board. I'm not scaring you that you go ahead and try to find a buyer for your medical practice, because these are not the problems, these are the opportunities which you can solve and earn more incentives from Medicare. And you can take the help of startup entrepreneurs. Talk to your billing company, talk to your EMR company, talk to your nurses, uh, incentivize them by finding where are the opportunities, and they can implement those opportunities in your medical practices. Like automation is very simple. You can talk to your EMR company, practice management company, and they can go over with the tools which are available in today's time to automate the entire patient engagement for you. um, you cannot just go by one or two patients and they say, hey, 20%, 30% of our patients are old patients, or 80% of our patients which are old, they don't want to they don't want to include they don't want to use phones for setting up an appointment, they don't want to use Apple Pay to pay their bills. Well, you would be surprised, I'm telling you. Once you start implementing those solutions in your medical practice, you would be surprised how much revenue can be generated extra just by automating your medical practice. Same way, for startup entrepreneurs, there are opportunities everywhere in Medicare healthcare, especially if you read these um, Medicare rules or Medicare changes, which comes every year. Not even every year, every 3 months, you can go on the CMS website, Medicare website. You can dig down the details, and you would find plenty of opportunities where you can innovate and come up with a better solutions which can make physicians' life better, more efficient. So with this, I am going to take a leave. If you have any questions, I do check my LinkedIn. I do check my LinkedIn right here. Send me messages, chat with me, and we can always explore more options, better opportunities for Medicare medical health industry in United States of America. With this, happy Veterans Day again. Happy Friday. I'll see you next Friday again. Thank you very much.